You to just mention the bone marrow because
Yes,
oftentimes with cancer and cancer treatment, that can be affected. And
yes.
why is that so important? Something we also have to be
Yeah,
aware of.
the bone marrow is the factory where all your blood cells and all your immune cells are made. And so having healthy bone marrow is incredibly important. As we age, the bone marrow ages as well and becomes less efficient. There's an anemia of old age that can set in. So if you have a cancer patient who's in her 80s, then you want to be concerned about her bone marrow just because of her age as well. So the bone marrow is found in the long bones of the body primarily, and it's a very rich environment of different kinds of cells, and there's some fat in there as well. And it is a very physiologically active tissue. In cancer treatment, the goal of cancer treatments is to stop cell division in rapidly dividing cells. So we're targeting the cancer cells, but there are other rapidly dividing cells in our body. And so when you have treatments like chemotherapy, which are targeting cell division, where are we going to see the side effects of chemotherapy? In the other tissues where there's high rates of cell turnover. So that's your skin, that's the lining of your mouth, the lining of your digestive tract. Those are some of the places, your hair follicles. That's where we see cancer side effects. And so the bone marrow can be really compromised by chemotherapy. And so most cancer patients will have low cell counts of their red blood cells, white blood cells, immune cells, and platelets because the chemo has not only affected the cancer cell, but it's affected the fast dividing cells, including the bone marrow. There are certain cancers that are diseases of the bone marrow as well. And so, for example, certain types of leukemias are where the white blood cells will overtake the red blood cells and other cells and crowd out all the other healthy cells in the bone marrow. And so you have too many white blood cells and not enough of the other cells. You have dysfunction of having enough immune cells and red blood cells when you have a cancer like that. So some of those patients will receive therapies where their bone marrow is actually ablated or completely damaged and then replaced. And so that's an extreme therapy and really is a small percentage of cancer patients. Most cancer patients are just having bone marrow compromise because of the toxicity of chemotherapy. So it's important then to support the health of the bone marrow. And that is really pretty straightforward and simple to do. One of the most powerful things is acupuncture, actually. And there are two very strong acupuncture points, stomach 36 and large intestine 4. And if you needle those points or apply heat to those points, the bone marrow is stimulated. So I actually teach my patients how to apply heat using the end of an incense stick. And you just hold the incense stick above the point and warm it up. And that stimulates the bone marrow. And so I just teach my patients how to do that at home. Then you're doing a therapy that's not interfering with drugs also. So you can do that. There's also in modern China, then cancer clinics in modern China, there is a formula that is given to chemotherapy patients to restore the bone marrow. And there is a company that makes that formula that I prescribe. It's called Marrow Plus. And it's made by a company called Health Concerns. And you take 3 capsules 3 times a day while you're undergoing chemotherapy. And for a couple months after you complete your treatment until the bone marrow and the cell counts come back to normal. Those are the main things. If your white cells go very, very, very low, you can also use a Chinese herb called astragalus, astragalus. Astragalus is also one of the most widely used immune drugs in cancer care. And so we use that not only for cancer immunity, but to restore the bone marrow's ability to produce white blood cells and immune cells. About 3 grams a day, 3,000 milligrams a day of astragalus. The only contraindication to taking astragalus is if you have autoimmune disease, if you have leukemia, or if you're on immunotherapy, then you would not use astragalus. But otherwise, it's quite safe. And in China, they also have this tradition of making medicinal soups. And so they'll put astragalus into the soup as well. And you can also nourish the bone marrow with another Chinese herb called dong quai, Angelica sinensis. And that is really lovely also to put into a soup. It's a blood building herb, more for the red blood cells. And melatonin is very good for platelets. Some cancer patients get very, very low platelets, which are the cells that are important for normal blood clotting. So if you have low platelets, you might bruise easily, for example. So melatonin at a dose of about 20 milligrams a day at bedtime is very good support for the platelets. And melatonin also has a very strong impact on cancer. So you get some cancer protection at higher doses of melatonin as well. So it's very important. If you see, I always monitor all the cell counts, as do oncologists. And it's very important to restore normal, healthy function to the bone marrow in the face of cancer treatments.
Wow, Dr. Nalini, I love all these things that you've learned and that
There's a
you
lot
add.
to do, right?
Oh my gosh, this is so wonderful. So tell everybody how they can learn more. Tell them actually about your OutSmart Cancer programs, because they're so fabulous. Your book's incredible. And just like today, where you give practical information that people can do, these things are doable and they can make such a big difference. So why don't you share about your programs and how people can access them?
Well, we have a bonus offer for your listeners, which summarizes everything I talked about today about bone health. And we've attached to that all of the supplements I recommend for every stage of the cancer journey. And that's available at the link integrativecaranswers.com/healthybones23. And so you'll put that link up, I'm sure.
Yes.
And so that will summarize everything that I've just talked about. In addition to, patients always ask, what supplements can I take? And so I think of the need for different supplements at different stages of the cancer journey. So we've included all that information for you with the bone information as well. And that will take you to my website, integrativecaranswers.com, where there's a lot of free information and about 200 recipes and about 400 blog posts with all kinds of information. And then you also mentioned my book at the beginning, 32 Ways to Outsmart Cancer, How to Create a Body Where Cancer Cannot Thrive. And that is really a good start to start changing your lifestyle and understanding what the big levers are to really, really transform your biosystem so that it is resistant to cancer rather than a happy home for cancer.
Oh, I love it. And what I really like is that it's not overwhelming. You know, the steps you can do, and you don't have to do all of them, but they're easy to implement and you're very clear how to do it. And it's just wonderful. I've been a big fan of yours. I guess since 2011, when I actually went back into health coaching, only being a physical therapist, but you've helped so many people and everyone who has had cancer and you know, both all aspects of it, prevention, as well as that there's just so much more than just killing the cancer. There's so much more, as you said, that it turns into a blessing in disguise. And I love that philosophy. Is there anything else before we end? We could talk forever. And I'm so grateful for everything you shared. And I know it's going to help so many of us. So is there anything else before we end that you want to say?
Well, what I really like people to remember is that you can have a big impact on your cancer journey, a big impact. And you can do a lot of things that don't cost any money at all. And then you can decide you want to invest in supplements and other types of care. But everyone is capable of transforming their outcome. And so it's really important to understand that. You have to really take the reins and build your health and build a cancer resistant body. And then you can really also have more peace of mind, which I think is really crucial as well.
Oh, well, we'll have all your links, but thank you so much. This has just been so informative. And again, I just appreciate all the work you're doing in the world and all the people's lives you've changed. So thank you for being here.